Good morning, students. So we are going to start respiratory medicine. So good morning, everybody. So there is a brief introduction about myself because you need to know with whom you are going to sit for next few hours. So wherever I start medicine, this is the first question majority of students ask me. Sir, medicine is a big ocean, lot of confusion. What is the solution? So this is the simplest way that I try to simplify medicine. For example, I'm sitting here and I'm speaking to you. It means there is something normally happening in my body which is making me to speak. So any process that normally happens in your body, it is called as physiology. So anything normal is physiology. Now anything abnormal happening in your body is called as pathology. Now for example, whenever I say my normal respiratory rate is somewhere 12 to 15 per minute, my heart rate is somewhere 70 to 80 per minute, I don't think why it is normal, because it is God's given gift to your body. And second important thing, whenever there is an abnormality, it is called as pathology. For example, there is a foreign body in patient's throat. So how will he fight against foreign body? So he'll try to expel it by increasing the cough reflex and also by increasing the respiratory effort. So what will be his clinical features? Shortness of breath and cough. It means whenever there is a pathology in your body will try to fight against that pathology. So how it fights will manifest as clinical features. Very simple. Anything normal happening in your body, physiology. Anything abnormal is pathology. How your body fights against it will be the clinical features. So this is the stage when this patient reaches to me for my assessment. Now I am going to see the patient, and with help of clinical examination and tests called as investigations, I come to a conclusion. What is this conclusion? Conclusion is nothing but diagnosis. Gnosis means identification. Dia means correctly. So to correctly identify the disease, I need some tests called as investigations. If you feel that this disease is due to some biochemical abnormality, what is the subject that you should be knowing about? Biochemistry. If you feel it is due to some microorganism, what is the subject you should be knowing about? Microbiology. Now students, if your eyes cannot see what is happening inside the body, so you should need an imaging system which looks into the body. So what is the subject dealing with all this imaging system? Radiology. Now putting together your biochemistry, microbiology, radiology, you come to a conclusion. What is this conclusion called as? Diagnosis. Now after diagnosis, what will be the next step? You should treat, or else nowadays patients will beat. So to escape that beating, you should know art of treating. So what is the subject dealing with the treatment drugs? It is nothing but pharmacology. Now see here students, if you take medicine as a big field, it is actually made up of all this put together. So in my discussion also, for important diseases, I'll tell you first what is normally happening, what abnormality has happened, how your body is fighting, and how I am going to identify and treat it eventually. Before going into the respiratory medicine part, I want you to introduce to the definition of medicine given by the great William Osler, who is considered as father of modern clinical medicine. He mentions that medicine is a science of uncertainty and an art of probability. So if you can understand this definition, you can understand medicine better. What I mean here is, see, a patient might be having a symptom called as shortness of breath. A patient might be having a symptom called as shortness of breath. So if you open the textbook, there will be 100 causes for shortness of breath. So there will be multiple causes. So starting from respiratory system causes, your metabolic system, cardiac system, renal system, GIT system. But your expertise does not lie in knowing all these multiple causes. Your expertise lies in that given clinical scenario, what is the probable diagnosis? A single symptom can be due to so many uncertain diseases, but your expertise lies in not knowing all those multiple causes. See, if you just know those multiple causes, it is theoretical medicine. What we are worried about is clinical medicine. So in that given clinical scenario, you must be able to identify the probable diagnosis. So to make you understand this clinical scenario based questions, I have made some 30 cases which I have taken from my own experience. So these 30 cases will be discussed in the class and later uploaded as PDF. You can go through the cases for better understanding of the concept. Now coming to recent NEET INI set trend, more of case scenario based bulky questions. See, previously if there were 200 questions, 190 questions were one-liners. Now the trend has changed. About still one-liners are there, but they have also included case scenario based. 30 to 40% have been case scenario based bulky questions. And in that, most important is focus and on which point is important. Now if you see in this image, actually she is the important one, she is the distraction. So whenever they give you lot of data, they will be giving a lot of information to distract you. So you should not go into that distraction. If you go into that distraction, your life will become a distraction, just like in this image. So in that image, most important is this, not this. So that's why you should know what to focus when there is a given question. So don't get attracted by distraction, because your life will become a distraction. Understanding and applying the concept is key. You should not only understand the concept, you should also know how to apply in the given clinical scenario. And whenever there are so many big questions, time management will also be very, very important. So you can only practice time management by doing multiple questions in the form of subject wise tests, grand tests, class tests. If you do as many tests as possible, time management will become very, very easy for you. Before starting the class, I would like to tell you, never let down yourself thinking that I am an average or ordinary student and I cannot do extraordinary things. So this actually happens whenever you are starting a big subject called as medicine. So what you feel is, all these years I did not study anything. Even if I start studying now, I may not do what is required. But the truth is, the difference between ordinary and extraordinary is only that little bit of extra. So that little bit of extra is what we are going to discuss in these few hours, and we are going to achieve those exceptional outcomes. So put that little bit of extra effort to achieve those exceptional outcomes. So we shall walk confident rather running confused. Like I told you, for all important topics, I'll tell you what is normally happening, what abnormality has happened, how your body is fighting it, and how are you going to identify and treat it. So now let us see the first topic. Basic role of surfactant. So even though this surfactant will be very well cleared in your it will be told in your obstetrics and gynecology and pediatrics, why I am discussing here is, only if you understand the role of surfactant, you can understand few diseases in adults. So surfactant is predominantly made up of dipomethyl phosphatidylcholine. So this can be asked as a one-liner. It is produced by type 2 pneumocytes. It is removed by pulmonary alveolar macrophages. So very simple, students. Surfactant is predominantly made up of dipomethyl phosphatidylcholine. So this is the major component of surfactant. How is it produced? It is produced by type 2 pneumocytes, and it is removed by pulmonary alveolar macrophage. Surfactant is removed by pulmonary alveolar macrophages. Coming to the functions of surfactant, it reduces the surface tension. It maintains alveolar stability, and a property of lung called as compliance. Compliance is nothing but stretchability. Of your lung. So don't worry, just note it down. I'll discuss each and every point in detail. Now this surfactant production starts at 20 weeks. it will be highest at 35 weeks, and less than 35 weeks any baby born will develop RDS. What is meant by RDS, students? RDS means respiratory distress syndrome. RDS means respiratory distress syndrome. Because it happens very early after birth, it was also called as neonatal respiratory distress syndrome. And later, because of this disease, there can be damage to alveolar cells, and all these alveolar cells which were damaged forms a fibrous layer which appears very pink under microscope. So this pinkish areas of damaged alveoli are called as hyaline membranes. Because hyaline membranes are formed, this disease is also called as hyaline membrane disease. This disease is also called as hyaline membrane disease. So few basic concepts here. What is surfactant? It is produced by type 2 pneumocytes. It is removed by pulmonary alveolar macrophages. It is removed by pulmonary alveolar macrophages. So this is maintaining surface tension. It maintains surface tension, a property of alveoli called as alveolar stability. And compliance. Compliance is nothing but stretchability. So when surfactant is not formed properly, there will be neonatal respiratory distress syndrome, also called as hyaline membrane disease. Now let us understand the pathophysiology. Now consider in one hand there is a balloon, in other hand there are few alveoli. So whenever I blow air into the balloon, this balloon will completely stretch, and when I release its neck, it will completely close like this. Whereas your alveoli, during inspiration they will open, during expiration they will close, but not completely. Even at end expiration, part of alveoli are kept open. What is the reason behind that? Because there is a substance called as surfactant which is keeping it open even at end expiration. Now whenever surfactant is less or surfactant is not properly formed, just like your alveoli will close at expiration. Now whenever your alveoli are getting closed, now tell me students, to open this closed alveoli during the next inspiration, should the baby apply more energy or less energy? More energy. If somebody is putting more energy in respiration, what will happen to their respiratory effort? It will increase, and they will develop respiratory distress. Because respiratory distress is happening very early after birth, it is called as neonatal respiratory distress syndrome. So write down, normally at expiration your alveoli will be partially open like this. What is the reason for alveoli to be partially open? Because inside the alveoli there is a substance called as surfactant. Now whenever there is surfactant deficiency, just like a balloon, your alveoli will be closed. Alveoli collapsed. Alveoli collapse is also called as atelectasis, students. Alveolar collapse is also called as atelectasis. Now common sense. To open collapsed alveoli, your body has to generate more work of breathing. So it has to concentrate more on breathing. So when somebody is putting more effort into breathing, will they be relaxed or will they be in distress? They will be in distress. Because respiratory distress is happening very early after birth, it is called as neonatal respiratory distress syndrome. A simple question, students. For example, there is a patient with chest pain. He is coming to the emergency department. So what will be your initial investigation for chest pain? It will be an ECG. In the same way, when somebody is coming with some respiratory discomfort, what will be your initial investigation generally? A chest X-ray. Now how to approach to a disease on chest X-ray based on the pathophysiology. How to approach to a disease on chest X-ray based on pathophysiology. Very simple, students. On a chest X-ray, let there be any physiology or pathology, it will only appear in two colors. What are the two colors? One is black and other is white. Very simple. What normally appears black on chest X-ray, students? Anything containing air will appear black on chest X-ray. What appears white on chest X-ray? Instead of calling it as your heart, diaphragm, ribs, very simple. Anything containing air will appear black on chest X-ray. Anything containing less air or no air tends to appear white on chest X-ray. Now, why is your heart white? Because it is not containing air, it is filled with blood. Why is your diaphragm white? It is not containing air, it is made up of muscle. Why are your bones white? Because it is not having air, it is made up of bone. So in simple words, anything containing air will appear black. Anything containing less air or no air should appear white. Now, how to approach to a chest X-ray based on pathophysiology? Actually, there are a few steps. So first step is, will the given disease cause a whitish abnormality or blackish abnormality? Whitish abnormality or blackish abnormality. And second concept is, and will this abnormality be localized or more diffuse? And third concept is, what will be the specific pattern of that abnormality? What will be the specific pattern of that abnormality? Color of the abnormality, extent of the abnormality, specific pattern of that abnormality. Now let us see with example called as respiratory distress syndrome. Now tell me, students, what will be the color of the abnormality? So will it be black or will it be white? So now you know that generally your alveoli are filled with air. So whenever they are filled with air, they appear black. Now your alveoli are getting closed. So whenever alveoli get closed, the areas are not having any air. So it will be a whitish abnormality. Second step. Now will this whitish abnormality be localized or bilateral diffuse? So whenever surfactant deficiency happens, it happens throughout. So there will be bilateral diffuse whitish abnormality. Then what will be the pattern of abnormality, students? What will be the pattern of abnormality? So the pattern of abnormality, initially all these tiny alveoli, whenever they close, you can see some bilateral whitish dots. So this bilateral whitish dots is called as granular pattern. As time progresses, this will become still more white. This is called as ground glass opacity. Still more white, consolidation, completely white, white out lung. So nothing but granular pattern, ground glass opacity, consolidation, and white out lung are nothing but increased intensity of white with respect to severity of the disease. So write down the radiological findings. One can notice bilateral granular pattern, bilateral ground glass opacities, bilateral consolidations. Don't worry about all these opacities. When I discuss various respiratory diseases, I will show you each and everything in detail. Bilateral ground glass opacities, bilateral consolidation, bilateral whiteout lung. Now coming to the treatment part. So initially the treatment will be oxygen plus CPAP. What is meant by CPAP? It is continuous positive airway pressure. So how CPAP works when I discuss obstructive sleep apnea, I will let you know in detail. If not improving, so you have started oxygen and CPAP. If not improving, the next step will be intubating the baby. And what is the problem here? Surfactant deficiency. So you might require surfactant replacement. How it is done? It will be discussed in detail in pediatrics. So even though this is a disease that we are going to see in a pediatric population, so why did I discuss in adult respiratory medicine? So I am the person who is dealing with adults. So why did I discuss this disease in adult respiratory medicine? Because in adults also there is a disease with similar presentation. Can you guess what is this disease with similar presentation in adults, students? ARDS. Only if you understand neonatal respiratory distress syndrome, later when we discuss ARDS, it will be easier for you. So even though all this is dealt in pediatrics, why did I discuss here? Because I want to introduce you to an adult disease with similar presentation called as ARDS, acute respiratory distress syndrome. So I want you to know the basics of surfactant so that you can understand ARDS in a better manner. Now this is case number 1. There is a preterm baby. So you have seen a preterm baby with tachypnea and cyanosis within 4 hours after birth. Chest X-ray is shown. What is the probable diagnosis? So preterm baby, tachypnea within 4 hours after birth. So this was the chest X-ray. Now what do you notice in this chest X-ray, students? For comparison, I will give you a normal chest X-ray. This is a normal chest X-ray. You can see the normal chest X-ray, majority of the areas are black. But if you see in this, there are bilateral whitish areas. And if you keenly see, you can see some whitish dots, students. You can see whitish dots. So can you see this bilateral whitish dots? See, compare. So this is the normal lung. So here you can see bilateral whitish dots. So these bilateral whitish dots are nothing but granular pattern. So this is a bilateral granular pattern, and baby is having respiratory distress within 4 hours after birth. So what might be the reason? Surfactant deficiency. And what will be your diagnosis? It is a case of neonatal respiratory distress syndrome. Or they can modify the question and ask you, what is the reason behind respiratory distress? So then your answer should be surfactant deficiency. So these are some examples of clinical scenario based questions. Now as I told you, what we are going to discuss will be completely adult respiratory medicine. So the same diseases will be later discussed in pediatrics, few diseases. You follow the guidelines there. So this topic or this discussion is strictly for adult patients only. So this is strictly for adult patients only. Whatever guidelines I discuss, it is generally applied to adult patients only. Now we have discussed surfactant deficiency. Now can you tell me, students, is there any disease happening in adults due to surfactant excess? See, anything excess is also not good. So excess boyfriends and girlfriends is also not good.